My name is Jeffrey Coe, MD. I'm an orthopedic spine surgeon. I practice in the Silicon Valley region of California in the United States of America. I've been in private practice there for 21 years and have devoted most of those years to the exclusive practice of spinal surgery. I've been a member of AIMIS since its inception several years ago. I'm one of the founding members, and I have been to Cyprus now 4 times, involved in surgery on many of those occasions, and I am very happy to have brought one of my patients to Cyprus, Mr. Jim Clow, who's with us here today. So Jim, can you believe in your wildest dreams that you'd be sitting here talking to me one day after your surgery at AIMIS in Cyprus?
Absolutely not. I mean, most of the stories I've heard from the research is 6 months, and then maybe you might start feeling better. I can't believe it. The pain that I have down my legs on both sides, which most doctors couldn't even identify what was causing it, is now gone in one day.
Now, one of the reasons that you made the personal choice, it's both an emotional choice and a financial choice because you've had to pay out of pocket, is because there was technology available here in AIMIS that's not yet available in the United States. Can you tell us a little bit about that?
That's true. From what I read, actually, the clinical trials are going on in the United States right now, but to have it actually available maybe 3 to 5 years out, and it's a maybe. I've already suffered for 5 years. I was looking at pretty much retiring because I couldn't stand it any longer. So this has given me an option to get my life back on track, and I really appreciate it.
The Food and Drug Administration of the United States of America is very, very protective and strict on the incorporation of new technologies in the United States. They do that out of a sense of duty to protect the American population who are felt at times to be vulnerable to what might be considered technologies that might ultimately prove to be harmful. However, it's pretty clear that there are technologies available that have already gotten the European Union's CE mark,
Yes.
that have gone through clinical trials in other countries, that have gone through clinical trials in other countries, and perhaps have even completed the first phases of clinical trials as the XL-TDR device has in the United States. But now, in this quiet period, before we anticipate the FDA approval, there are patients like yourself that would benefit from this technology, and they have no other choice to get that technology but to go to another country. Would you agree with that statement?
I would. At times, I don't completely understand the motivation of the FDA. I know originally they were designed to support the patient, and what Dr. Cole is absolutely correct. You know, there are some devices out there that could cause harm or may cause harm or shouldn't even be on the market. Part of the research that I did was to see, I didn't want to be the first person for this procedure because I didn't want it to fail. So I wanted to find out, is there a track record? And I did look this up. And I noticed that the surgery has been going on for a while. So I do agree with you. It would be nice if the patient and the insurance company will allow the person who's in pain to make the choice, because I think a lot of people are excluded from it for financial reasons. And even for myself, it's kind of a chance that I know that by doing this, I can still work a couple more years. And by doing that, I can pay for the surgery. So that's part of the reason.
Thank you. Getting back to the FDA issues again, don't you think that it's important for patients, if they do their own research, they've made their own judgment, they've done as you have, look at the clinical data that's available, be able to make those choices, and if they choose to take what we call the medical tourism route to get technology that's not yet available in the United States, don't you think they should be permitted to do so and perhaps have the opportunity to have that covered by their insurance?
Absolutely. What is insurance for? I mean, it's for risk management, essentially. So you pay all this money into the insurance company, and they're not supporting you in some areas. And it's almost like, well, what areas will they support you in, what areas they won't? And it's unfortunate that it has come to this, but it did in my case, that I actually had to pay out of pocket for it. And I do agree, it is your body. You should be able to choose what you need to do, with it. And being reasonable. Of course, we're not the experts. And the way I approach things, people have been trained to be experts like yourself. But there's a lot of people out there that say they're experts and they're not. So it's really trying to weed out who are those people. And the research is really important to find out, is this person qualified? Is this a fake company? Has other people done this? If you can get testimonials, which I did also, because they had a previous product called X-Lift, which is very similar, but this is a little bit better, I think. And do the research. And definitely, you have to come to that conclusion yourself. But I really do believe that insurance companies should be there to support you. And in my case, I felt that they failed.
Now, one of the catchwords in medicine right now, particularly in this era of Obamacare, is value in medicine. Most patients are somewhat isolated, or at least firewalled, to use an IT term, that's your profession, from the expense of the day-to-day medical care until they come into a situation that is a little bit unusual like yours is. Having made the decision to come to Cyprus at your own expense and pay for the surgery out of your pocket, I know it's only the first post-operative day, but do you see value in your experience here at AIMIS from what you've had to pay so far based on your early experience?
I do see value because I now have hope, and it's somewhat hopeless before. And AIMIS has provided that for me. And even being here and talking to other patients that have had this 6 months ago, a year ago, they're walking around like nothing's happened to them. I mean, they're energetic. It's incredible, actually. And it's real. This isn't fake.
Now, what do you think of the experience of coming to a place that is close to paradise almost, recovering in a 5-star hotel on the Mediterranean Ocean, and are going to have the opportunity within 3 days, when your wounds heal up a little bit, to be able to step into the Mediterranean Sea and enjoy life once again?
I'm actually looking forward to it. I'm looking forward to my first shower, which I understand this being the second day I can have one.
That's correct.
Which is great. And Dr. Cole mentioned that in a couple more days I'll even be able to go into the ocean, and it has salt water and stuff, and I won't have a problem. Just take a shower afterwards. The place is really beautiful. The ocean's really beautiful, and the people are very friendly. And their crime level, I'm not sure, from my understanding, it's very low. But everybody that I've contacted within the AIMIS organization and their affiliates, all the way down to the taxi cab driver, has been there to help and support. And they're like, they're really wishing for the best for me, and that's really nice play.
Can you tell me a little bit about your family's support in your decision-making process and coming over here? I know that your lovely wife was unable to come for personal reasons, and therefore you're here by yourself. Normally a family member would come. But your family, I understand, supported you very much in your decision to come to Cyprus.
It's definitely a tough decision, and my wife did support me, because you have to look at the numbers and what's the possibility, and what are you going to be doing the rest of your life. And with what I was facing, it was kind of my life as I knew it was going to end. And then I also heard people from other that have had this issue and didn't get resolved could actually not be around that much longer. Depression occurs, things of that nature. So once I really kind of laid out the options of what I was looking at, I did get support from family members, and I really kept it close, because the more people you talk about it, a lot of people have had experiences, and some of even my close friends do not know that I've done this yet. And I'll come back and let them know there is good news, there is hope. And so that's what so there is that possibility, which is great, versus no possibility from where I was coming from before I found AIMIS.
Well, Jim, I think you've been extremely forthright about your experiences here. Granted, you are barely 24 hours post-operative from a procedure which most patients, having had a disc replacement at the level that you've had in their low back, would probably still be in the hospital with tubes in their body. So I thank you from the bottom of my heart for taking the time and speaking with us today. And I am honored personally to have had you as a patient.
Thank you so much. It really means a lot to me, and I really appreciate this. And I also really, it's not like this is I'm being paid or anything for this. You know, it's really, you guys are very giving people. And you're really trying to allow people an opportunity to continue their life. And I hope that this video can go out to people who are on that crest of what to do and help them make the right decision for themselves.
Thanks again.
Okay, thank you. Okay.